It is no longer news today that in our country, Nigeria, the rate of unemployment is alarming. But what is news today is the fact that there have been some people who have been paying their dues in different parastatals, be it health or other parastatals, but are yet to be absorbed in the sense that they are yet to be fully paid their dues called salary at the end of every month. And one of such persons are the FCT Health Workers Volunteer right here in the FCT of Abuja. These people have been crying out loud in their own way, but of course they have deemed it fit to come out loud through media to lend their voice to the fact that they are not being recognized in their own fatherland. And we're going to be taking some few interviews from one of such personnel who are right here in the city of Abuja. But before any further ado, I am Cindy Angel Eyes, also known as the co-host Cynthia, and this is Taza TV. Back into the world. Welcome.
I'm Ali Monde Daniel. I'm an FCT Native Health Volunteer. I'm from Kuje Area Council. I serve in Peggy PSC.
Okay, so can you tell us the reason why you have all gathered to have this voicing out today?
Okay, I'm here under the umbrella of FCT Health Volunteers Native. As you can see, these are members of the volunteers, few out of the many we have. Because of the ongoing COVID-19 vaccination, we are not able to come out in mass. We are here to call on the FCT as all, the director of National Primary Health Care Development Board to come to our head. Some of us have been serving for years, some have served in more than 9 years. We have been giving our best to serve as volunteers, but yet when employment comes, we are not considered. Some of us have left our parents. We are living in the facilities in the villages where we are. I could remember I visited a friend of mine who is staying in one of the facilities in Zokutu PSC where there is no network. The only place is he hung his phone on tree before he should even communicate to his parents at home. There is no water in the community, and he's serving there more than 4 years now. And some of us are serving like that, and yet when employment comes, we are not being considered. And we are called FCT Native. This is our land, but yet we are still crying. We are calling on our leaders to come to our aid to help us so that they employ and absorb the FCT Natives. When recommendation comes even from the local governments, they recommend us that we are doing our best, we are trying, we are serving our people, but yet when the employment comes, we are not being looked. I want to assure us that if we are being absorbed, this will help the FCT and the nation at whole. This used to help us when our people comes to the facility, they are not able to voice out their illness in the dialect, in English language. But when they meet us, they feel happy and they tell us how they are feeling, and that will help us to take a step in order to assist them in wherever they need assistance. So I'm calling on the Minister of FCT and other people, the chairman of the 6 area councils, to come to our heads, to listen to our voices and assist us by employing and absorbing us.
And not being absorbed into the system? Or should I put it in another way? Are you sure that you don't have persons from your Gbagi people that are already employed in the hospitals and every other healthcare center?
Actually, I will tell you, employment have been going on. But when we cry out, they tell us that since 2008, there is not any employment that have been done. But still, when we stay in the facility, we see some people coming with posting letter. And I want to assure you that most of them are not Gbagis. Even when Empower did employment, some of us, we are still there serving as volunteers. Some of us, we are not employed into Empowers. They bring some people to us to be serving our facility, and I want to assure us some of them they only reported and they were not. We are the one doing the work as volunteers. Why can't they help us? Even ad hoc jobs like that, volunteers supposed to be foot place considered first. So I'm advocating that any work, any employment that comes, volunteers supposed to be looked into first, because our service that we are rendering is very much. I am telling you that some of us, if you visit our facility, you ask our in charges, they will tell us. Visit some chiefs, you tell them, you ask them, they will tell you the work we have been rendering. So I'm crying that the FCT minister and the other high people should come to our heads to help us, to employ us. We are very, very much. And if they employ us, we promise we are going to put in our best.
It's all right. Thank you very much and have a nice day so far.
My name is Jennifer Daniel. I'm from Buari Area Council. I serve with Buari Town Clinic. Our challenge as volunteers, we really need employment because it's been long they employed, but when we are in the facility, we see others coming with their posting letter that have been posted to social facility, social primary health care. But we volunteers that have been serving for more than 5 years, some are even in their 10 years or as a volunteer, but no employment. When we cry to when we cry to the director or the in charges in the primary health care, they will say that employment have not been done. They are still on the process. But yet, people are coming, being employed. And most of the work that volunteers does in the facility it cannot be overemphasized because we do the major work. Permanent staffs are not much in the facilities. Highest, you will see 4, 5. But volunteers, you will see we are more than 10, 13 in a primary health care. And most of the work, they will be pushing it on us. You volunteer, go and do this, go and do that. Honestly, we are pleading the directors, the primary health care directors, the local government chairmen. We really need help.
I want to ask you this question. Since you have evidence of the fact that there have been people coming with posting letters to your healthcare facilities, what then do you now think is the major reason, the reason why these volunteers are not being absorbed as full staff into these healthcare centers? What do you think is the reason?
Actually, we don't know because most of them, they know where they enter. We don't have that means. We don't have money that we can go and pay.
And sorry, and you don't think it's because maybe you're not qualified for that job? You wouldn't say that?
We are qualified, in fact, more than qualified, because we have recommendation from our in charges. We have a recommendation in our the HOD as in HOD of health. We have recommendation that volunteers are really performing excellent job in the facility.
So, in one word, what is it that you're asking the government, especially the government of the FCT, to do for you who are volunteers?
We really need help. We need to be employed. If at all there is a slot or chances of employment, we are crying for us that we are less privileged, that we don't have anybody to voice out our feeling. That is why we have come in masses as FCT native health workers to voice out our cry that they should come to our aid and help us if there is need.
Of course there is need. Have a wonderful day, and I hope the government will listen to your plight. Thank you very much.
FCT native health workers volunteers. Your health is our concern. FCT native health workers volunteers. Your health is our concern.